Hello everyone, welcome to Physio World. My name is Udita Garg and I am a physiotherapist. So today I am going to present you a very interesting and important topic, posture. So stay connected. My presentation is covered under these subheadings. Before we start, I want to ask, has anyone ever told you stand up straight or scolded you for slouching at a family dinner? Well, that happened with me. Comments like that might be annoying, but they are not wrong. Trust me, your posture, the way you hold your body when you are sitting or standing, is the foundation for every movement your body makes and can determine how well your body adapts to the stresses on it. These stresses can be things like carrying weight or sitting in an awkward position, and the big one we all experience all day, every day, gravity. So, by definition, posture is defined as the attitude assumed by the body either with support during the course of muscular activity or a result of coordinated action performed by a group of muscles working to maintain the stability. So, what are the types of postures? Basically, there are two types of postures, inactive and active. As the name indicates, inactive means there is no work done by the body. For example, resting, sleeping. Active posture means work is done by the body. For example, walking, running. Active posture is again divided into static and dynamic posture. Static posture, a posture which remain constant. For example, sitting, standing, kneeling. Dynamic posture, a posture which is continuously modified or continuously changing. For example, walking, running, jumping. Now, posture assessment means how to assess the posture, whether it is a good posture or a bad posture. When you look at the spine from the front or the back, all 33 vertebrae should appear stacked in a straight line. From the side, as you can see in this picture, spine should have three curves. Okay, one at your neck, that is your cervical curve, one at your shoulder, that is your thoracic curve, and one at the small of your back, that is your lumbar curve. As we all know, cervical curve, the concavity, also known as lordotic curve. Thoracic curve, the convexity, also known as kyphotic curve. And again, lumbar curve, the concavity, known as lordotic curve. So, we are born with this S-shaped spine. Baby's spine just have one curve, just like C. The other curves usually develop by 12 to 18 months as the muscle strengthens. These curves help us to stay upright. The spine has these three natural curves. Your head should be above your shoulders, the top of your shoulders should be over the hips. Now, what is the ideal posture? When you're standing up, you should be able to draw a straight line from a point just in front of your shoulders to the behind your hip, to front of your knee, to a few inches in front of your ankle. As you can see in this picture, the yellow line passing through the ear, to the shoulder, to the hip, to the knee and to the ankle. This line of gravity should pass through specific points of the body. This line keeps your center of gravity directly over your base of support, which allows you to move. When viewed from either the front or the back, the vertical line passes through the center of the gravity. When you are seeing from the front, this line passing through your umbilicus, that is your belly button. While assessing your posture, you have to keep something in your mind, like first thing, your head alignment. It should be in a neutral position. It should not be in a flexion, extension, lateral rotation or lateral flexion. It should be in a neutral position. Your cervical spine. Your cervical spine, that is your lordotic curve, it should be maintained, not in an exaggeration. Your thoracic curve, it should be kyphotic. Your lumbar curve, it should be lordotic. The symmetry of your shoulders should be relaxed. They should not be in a protraction or retraction or in an elevation or in a depression. The symmetry of your pelvis should be maintained or in a neutral position. Your hip should be in a neutral position. Your knee, it should be at a right angle. And your ankle is flat on the floor, not in a plantar flexion, not in a dorsiflexion. Now, pattern of good posture. So, what is good posture good like? Simple, that keeps your bones and joints in a correct alignment. That is known as good posture. And poor posture which is inefficient. Like if your posture is in aftermost, your muscles have to work harder to keep you upright. Some muscles will become tight and others will be inhibited. Over time, these dysfunctional adaptations impaired your body's ability to deal with the forces on it. Poor posture inflicts extra wear and tear on your joints and ligaments and makes some organs like lungs less efficient. In fact, some researchers have linked poor posture to scoliosis, back pain, tension headache. Posture can even influence your emotional state too. Even sitting in an awkward position for a long time can promote poor posture. There are some factors responsible for the posture, either it is good or bad. So, factors responsible for good postures are good hygienic conditions, or stable psychological background, and opportunity for plenty of natural free movement. These are the factors for good posture. But for bad posture, your mental attitude, you should be stable. Your poor hygienic conditions, okay, prolonged fatigue, general disability and illness, some local occupational stress, muscular stress, these comes under poor posture. Okay. Now, types of poor posture, or you can say faulty posture. There are many types, but few of them are flat back. Most common, flat back. In this, there is the loss of lumbar lordosis in flat back posture. Loss of lumbar lordosis and posterior pelvic tilt. In lordotic posture, there is a inward curvature of the spine, as you can see, but in lordotic posture there is an exaggeration of that particular area. In kyphosis, there is increased convex curvature, as you can see in a thoracic region or in a sacral region. So there is an increased convexity. In sway back posture, there is hyperextension of cervical spine and also hyperextension of knee. And your ankle, they will be slightly plantar flexed. As you can see in this picture, the good posture, this is the ideal posture. In forward head posture, you can see your head is moving forward. In thoracic kyphosis, your thoracic spine, there is an exaggeration of convexity of the spine. In lumbar lordosis, you can see there is a exaggeration in the concavity of lumbar spine. Okay. Now, re-education of posture. What is re-education? Re-education is simple. It's just how to correct a poor posture, a faulty posture. How to train a patient to correct their faulty posture. Okay. So, there are some techniques basically for the re-education of the posture. For re-education, there should be good atmosphere. Okay, your patient may feel that acquisition of good posture is worthwhile. Efforts will be noticed and appreciated. Individual instruction, as no two patients have identical difficulties but have much common to learn, so group activity enable atmosphere of enjoyment and patient is stimulated by working with others. So, your first technique is relaxation. Relaxation of the muscles to reduce the tension. Those muscles which undergone in tension, you have to reduce the tension in those muscles by PMR, your progressive muscle relaxation. Another one is muscle strengthening. The basic principle of working correctly and safely is to plan balanced activity that helps to maintain both muscle strength and flexibility. Another one is muscle stretching. You have to work on the muscles. You have to stretch the muscles which are tight. Now, postural correction. Postural correction is depend how the posture is. Like I told you, the types of faulty postures. Sitting on a stool, the patient relaxes into the fully flexed slouch posture with the head and chin protruding. That is your forward head posture. Then the patient then smoothly moves into the erect sitting posture with the lumbar spine positioned in maximal lordosis and the head retracted and chin pulled in. The patient is thus instructed to move into an extreme or lordosis but then release the last 10% of the movement. The sequence should be repeated several times in a flowing manner. That's how we correct the posture. Now, another one is taping. Taping can correct posture by relieving stress on overstressed tissues and by guiding soft tissues into a position. Elastic tape is advocated for use in postural correction because it does not limit movement entirely and is more comfortable than rigid tape nowadays. And last one is myofascial release. In myofascial release, you see there is a tension in fascia that restricts the movement. So you have to release the tension in the muscle. So overall, if complete pattern of good posture by these techniques, it must be built up gradually and progressively. The new posture becomes habitual and no longer requires voluntary efforts. It is maintained by conditional reflexes. Now, benefits of good posture. What are the benefits of good posture? There are many benefits, really. Like back pain relief, the most common. Back pain is a devastating problem. Okay. It's a 50 billion industry and affects 80% of the population according to the American Chiropractic Association. So anything that can provide back pain relief is an excellent idea. Proper posture helps to keep your bones, joints, ligaments, and muscles properly aligned, which can prevent and relieve your back pain. Plus, over time, good posture can change the anatomical characteristics of your spine, leading to less strain and more open vessels and nerves. Another one is improved muscle health. It is another way that proper posture provides pain relief is through strengthening your muscles. Improper posture places strain on already sensitized muscles and soft tissues. By sitting and standing correctly, you will strengthen your core, buttock muscles and back extensions while relieving unnecessary tension. The reality is that good posture distributes the force of gravity evenly throughout your muscles. So no one structure is overstressed. Okay. Another one is it improved concentration. You know what? The average human brain has over 100 billion neurons and 1,000 trillion synaptic connections. Okay. These neurons and synapses are responsible for your memory, concentration, and all information transmission in your brain. And these receptors are especially dependent on oxygen. By improving your posture, you open up your body to better oxygen and blood circulation, meaning that you will also improve your ability to concentrate and focus. Okay. Now, next one is improved breathing. A study by the American Academy of Physical Medicine and Rehabilitation, they revealed that bad posture can affect your breathing and lung capacity. The reason why is because of your frontal muscles and tendon. When you regularly slouch, these muscles become shortened, which decreases your body's ability to take deep breath. In fact, slumping in your seat or standing with rounded shoulders greatly decreases your ability to take in oxygen. By practicing good posture, you can improve your breathing ability by as much as 30%. Okay. Now, next one is improved circulation and digestion. This is especially true when it comes to your digestive system. Seriously. Good posture helps to keep your internal organs, particularly those within your abdomen, in their natural position without undue compression. When you slouch, you can interfere with the normal flow and function of your gastrointestinal system. Remember, in fact, proper posture can help relieve such issues as acid reflux, constipation, hernias. Okay. Now, most important, it decreases fatigue and depression. Some researchers conducted by San Francisco State University, they revealed that simply choosing to alter body posture to a more upright position can improve mood and energy levels. The reality is that your posture has measurable effects on your optimism, energy, and even mood. The reason why is because your posture affects your state of mind automatically when you are depressed. Your shoulders automatically slump, while when you are relaxed or feeling happy, your posture tends to be upright and open. By changing your posture to reflect the state of mind you want, you can actually make it happen. So try to correct it. Like, try sleeping on your side with your neck supported and a pillow between your legs. It's also not enough to just have a good posture. Keeping your muscles and joints moving is extremely important too. In fact, being stationary for a long period with good posture can be worse than regular movement with a bad posture. When you do move, move smartly. Keep anything you are carrying close to your body. Backpack should be in contact with your back. Be sure to exercise. Using your muscles will keep them strong enough to support you effectively on top of all the other benefits. If you're really worried, check with your physiotherapist, because yes, you really should stand up straight. Thank you for keeping your patience. I hope you like my video. Thanks again. Stay home. Stay safe.